Hello everyone. So our topic is treatment of eating disorders and body image concerns in transgender diverse individuals. And I'm Katie. So before we get into causes or treatment, I want to start with the big picture. Right now, about 0.5 to 2% of people worldwide identify themselves as transgender, and that number is even higher in younger generations. So what really stands out is the level of risk. So transgender youths are about 2 to 4 times more likely to report eating disorder symptoms compared to cisgender peers. And in a large national college study, transgender students had much higher rates of anorexia, bulimia, and purging. We also see higher rate of behavior like fasting, vomiting, and using laxatives to control their weight. So when you put all of that together, it raises an important question. Why are these rates so much higher? So one big reason is minority stress. When people experience stigma or discrimination over time, it can really affect their mental health. So studies show that while there are strong links between internalized stigma and anxiety, depression, and some other mental health challenges. And there are also high rates of mental health concerns more broadly in gender dysphoric populations. And on top of that, unhealthy weight control behaviors are more common in sexual and gender minority groups. So, eating disorder risk here is shaped by both gender dysphoria and the social stigma, and that's why we need good and affirming care.
So, when we're talking about trans people with eating disorders, something that we need to understand is that trans people can have eating disorders without the body dysmorphia element, and that's not the case for all trans people. But an important thing to understand about how trans people develop eating disorders is that gender dysphoria and being trans centers around whether or not you have control over your body, whether or not you get to exist in the body that you want, and whether or not you get to make changes to your body. And trans people don't stop being trans when they don't have access to that care. And if you don't have access to medical care, if you don't have access to resources for transition, something that you always have control over is how much you eat. And the effects of being malnourished, of an eating disorder, can sometimes be more preferable than living in your body when you don't have any other options.
Even though the risk is high, many transgender and gender diverse clients report negative experiences in eating disorder treatment. And some of them just, well, they describe their feeling misunderstood or invalidated. Trans adults also report needs in primary care, especially when it comes to gender related concerns. And part of the problem is that traditional eating disorder frameworks were developed around cisgender experiences. So they don't always reflect how gender dysphoria shapes eating disorders. There is also a clear need for stronger clinician training in transgender care. Because of these gaps, we can see three major issues. First, misgendering and lack of affirming care. Second, failure to address gender dysphoria when conceptualizing eating disorders. And third, a lack of integrated, holistic support between medical and mental health providers.
I think when we're talking about quality care for trans people, we have to acknowledge that having an LGBTQ specialization, having being a gender health provider, all this stuff, what they actually require of you is the bare minimum. There is a bare minimum amount of work that you have to do to say that you are qualified to work with queer people. And because queer people have so few places to go to get care like that, they just accept that. They just accept your qualifications. And you end up in situations where your provider is talking about a how you have a condition, and then you ask what's your evidence for that, and they say, "Oh, sorry, I forgot that you're not male." Gender health specialist, by the way. And you get therapists where it feels like you're doing all of the work. You are bringing everything to the table. You are doing all of the educating. You're doing everything. And it's frustrating, and it leads to trans people avoiding these resources.
So, when it comes to treatment, standard approaches like CBT, family-based treatment, and DBT are still important. These therapies focus on changing harmful thoughts, improving eating patterns, and helping with emotion regulation. But they were mostly developed using cisgender samples. So for transgender use, they need to be adapted, and clinicians need to directly talk about gender dysphoria and minority stress instead of ignoring them. In addition, gender affirming medical care also plays a role. Research shows that hormone therapy or medical transition is linked to lower body satisfaction, and sometimes it can reduce eating disorder symptoms. When providers directly address body related dysphoria, people often feel better overall. That's why many experts now recommend combining mental health treatment with gender affirming medical care. And the care should also be trauma informed and culturally responsive, especially since many transgender youths have had negative healthcare experiences. So overall, the field is moving toward more integrated and affirming care. In the end, we need a more holistic approach. We can't treat eating problems, gender dysphoria, and stress from discrimination as just they were separate things. They are connected. And different providers need to work together, including doctors, hormone specialists, and therapists, and their dietitians. Even something simple like just using the right name and pronounce can make a huge difference. And this is also a part of treatment too. And instead of focusing only on the weight, we need to focus on the whole person in front of us, including their identity and overall well-beings.
Ultimately, the experience of being trans is the experience of wanting to be real, wanting to be a whole person. In a world that wants to define your personhood, cut squares out of you, take parts of you away, erase your existence. It is the experience of being unwanted and yet still being there. And if we don't have care that validates the experiences of trans people, that sees us as real, that sees us as a whole person and not just a set of labels, that actually has the capacity to understand us. If we don't have that, then there is nothing that we can do. There is nothing that any of us can do to make this world a safer place for trans people until we create those conditions.